depends on receiving the right medical attention.
Las personas que vivimos con enfermedades graves deberíamos vivir con este nivel de miedo y inestabilidad. Merecemos acceso a atención médica y estabilidad en nuestros tratamientos y la oportunidad de vivir con dignidad.
People that have this type of very difficult conditions should not live with this level of fear and instability. We deserve the right medical attention and stability in our treatments and the opportunity of living with dignity.
Respetuosamente les pido que consideren mi situación y tomen acción para asegurar que las personas con enfermedades graves podamos seguir recibiendo la atención que necesitamos en nuestra vida, depende de ellos.
I ask not only for myself, but for thousands of people that are in a similar situation. Congress needs to take action now and stop taking away the funding for these life-saving conditions. Because these type of conditions are very difficult if we don't receive the right attention that we need so that we can have a life of dignity, because our lives depend on them. I hope that you can listen to me.
Gracias por escucharme.
Thank you.
¿Qué queremos?
¡Justicia!
¡Justicia! ¡Justicia! ¡Justicia! ¡Ahora, ahora! ¡Ahora, ahora! ¡Ahora, ahora! ¡Ahora, ahora, ahora!
What do we want?
¡Healthcare! ¡No!
What do we want?
¡No!
What do we want it?
¡No!
No cost to health care. No
Costa Care! No Costa Care!
No
Costa Care!
No
Costa Care!
No cuts to health care.
Okay.
No cuts to Medicaid. All right, everybody. So right after this, the House Republicans on the Energy and Commerce Committee have initiated a major investigation, and they're going to have a hearing about that, about Medicaid fraud that they've made up in these 10 states. This probe is being framed publicly as a crackdown on, quote, fraud, waste, and abuse. We heard that from some of the Doge tech bros, right? But it's part of a broader policy strategy to weaken Medicaid programs in states that have expanded access and invested heavily in making sure that all of us can get the health care that we need. So regardless of what they say, we know that it's the Republicans who have been trying for years to gut Medicaid spending and to fund, and for no other reason than to fund tax cuts for billionaires. And our next speaker knows that it's not just Medicaid, it's the entire healthcare infrastructure, because she fought tirelessly to save the Affordable Care Act back in Trump's first term. It is my honor to introduce the hero, Elena Hung from Little Lobbyists. Woo!
Thank you. Hello, everybody. Hello. Hi. We are here today, like Jen said, because House Republicans have initiated this investigation alleging fraud, Medicaid fraud. But the actual reason that we are here today is to protect Medicaid. Protect Medicaid from these political games designed to distract us from the real fraud and real abuse, which is that billionaires are getting richer while families who rely on Medicaid are losing health care. I am Elena Hung. I am the executive director and co-founder of Little Lobbyists, which is a family-led organization advocating for children with complex medical needs and disabilities. I'm here on behalf of families like mine, families who rely on Medicaid to survive and thrive. I'm here because of my daughter, Xiomara, who is the joy of my life. She was born with a number of serious medical conditions affecting her airway, lungs, heart, and kidneys. But thanks to Medicaid, Xiomara is thriving today. Thanks to the in-home and community-based care, she's able to go to school with her peers and live at home with her family. Medicaid is health care. That's what it is. Medicaid is home and community-based services like personal care attendants and home nurses. Medicaid is housing support services. Medicaid is hospice and end-of-care life. It's services for elderly and disabled adults. Medicaid is not a cash benefit program. Families like mine don't get a check in the mail. That's not how Medicaid works. Medicaid is health care, and it is often the difference between life and death for families like mine. Health care should not be politically motivated nor partisan. Disabled children belong to families of all political persuasions living in every state across the country. And these delays and cuts are devastating to families like mine, particularly those in rural areas, as we watch hospitals and providers close their doors. There are ways to ensure the integrity of Medicaid programs, but these political investigations and accusations of fraud are not it. What the House Republicans are doing is weakening Medicaid and harming families across the country. This administration's attack on disabled and medically complex Americans is laying the groundwork to dismantle Medicaid. Medicaid is an essential part of what makes the American healthcare system function. Without Medicaid, 83 million Americans will face a healthcare crisis, but so will hospitals, physicians, and other cornerstones of the healthcare infrastructure across the country. So we are here to protect Medicaid. Thank you.
Protect Medicaid. Protect Medicaid. Thank you. Healthcare is a human right. Fight, fight, fight. Healthcare is a human right. Fight, fight, fight. Healthcare is a human right. Fight, fight, fight. So these House Republicans on the Energy and Commerce Committee, they sent letters to the state governors and the health agencies in each of the states. And I'm just going to read out the list of states because, and let's actually pick out the common denominator of all of them. It's New York, California, Colorado, Massachusetts, Maine, Nebraska, Oregon, Pennsylvania, Vermont, and Washington. This is just the first batch, though. The staff of these Republican Congress members have told us that they are going to write these letters to more states. But in the states, they've narrowed down on several program categories that they claim are particularly vulnerable to fraud. And in their minds, that means they shouldn't be allowed to be funded anymore. And if you're at home and you think, well, I'm not on Medicaid right now, so this doesn't impact me, let me just talk a little bit about what these programs are. In-home and community-based care. These are personal care attendants, home health aides. These are the folks that you call when your aging parents are getting sick and they need round-the-clock care, or someone that you know and love has an illness or is in an accident and needs someone to come into their homes. Housing support services, applied behavioral analysis and other services for children with autism, services for elderly and disabled adults. That's all of us, y'all. That's where we're headed. Every single person is going to have to call upon these resources. Substance use disorder treatment, including residential and outpatient programs. Hospice and end-of-life care, adult day care programs, services for people experiencing homelessness, and they call it so-called non-emergency medical transport for things like dialysis, which actually is it actually is an emergency. It actually is essential. Prenatal care and chemotherapy. It is nothing short of cruel. And people every day who are working with people who are caring for loved ones who need to rely on these services. We're going to hear from Nicole Jerwick, who's the Chief of Programs from Caring Across Generations, who represents caregivers. Thank you, Nicole. Yeah, all right, Nicole. Thanks so much.
No cuts to health care!
No cuts to health care!
No cuts to health care!
No cuts to Medicare!
No cuts to health care. All right, thank you so much, everybody. My name is Nicole Jorwick. I am the Chief Strategy Officer for Caring Across Generations. We are an organization that's focused on changing policies and narratives around care and caregiving, just like some members of Congress are trying to do, but we're trying to do it the right way. We bring together aging and disabled people, family caregivers, and care workers to build the care systems that we all need and deserve. I am here today because the current patchwork system that is Medicaid, while far from perfect, remains under attack. The administration and the Department of Health and Human Services and some members of Congress are making dishonest claims about the care recipients who utilize Medicaid and are specifically targeting the health and independent living rights of people with disabilities, older adults, family caregivers, and direct care workers. These claims are especially intended to undermine vital home and community-based services like the ones that were just laid out, from personal care attendant services to non-emergency medical transportation, calling them on their face fraud, and also sharing a really out-of-date and antiquated narrative that these are things that families should do. Families are already doing them to the cost of $1 trillion to the economy every year. It cannot be overstated enough that the weaponization of waste, fraud, and abuse is actually an attempt to provide cover for the majority in Congress who voted for the biggest cut in Medicaid history, which threatens care for 80 million Americans, including aging and disabled care in people's homes and communities and other essential supports. This isn't conjecture. The $1 trillion cuts from last summer are already showing up in state houses, and home care has been put on the chopping block first, leaving people with disabilities, older adults, and family caregivers to face tens of hundreds of thousands of dollars of out-of-pocket care or going without entirely. States have already seen cuts, cutting rates, and providers closing their doors. This pain reaches every zip code, every community, and every family. I want to be really clear that the focus of the hearing being held this afternoon with trumped up narratives around fraud, waste, and abuse is ultimately only about one thing: continuing attacks on funding for Medicaid. All I keep thinking about is what apparently some members of Congress and the administration have forgotten: the people who will be harmed. People like Cindy, a mother, grandmother, and family caregiver from Baltimore, who will feel these cuts from all sides. Cindy is caring for her 90-year-old mom, her disabled brother who requires that personal care that is being called fraud, and 3 young grandkids all at once. Without Medicaid coverage, Cindy can't afford wound care and medication for her brother or doctor's visits for her 3 grandkids. This is not a rare scenario for the 130 million family caregivers in this country and the patchwork systems that they rely on to provide care for themselves and their families, and they remain under attack now in new ways. I've seen this strategy before. Lie about the problem so that they can get away with cutting the care that people need most. Congress cut nearly $1 trillion from Medicaid last summer, and now when families are just starting to feel the impacts at the state level, they're trying to justify these cuts by devaluing the life-saving essential care that families rely on. We can't and will not fall for it. Medicaid and the lives of 80 million Americans depend on it.
When Medicaid is under attack, what do we do?
Stand up, fight back!
When healthcare is under attack, what do we do? Stand up, fight back! When healthcare is under attack, what do we do? Stand up, fight back! What do we do? Stand up, fight back! What do we do? Stand up, fight back!
All right, everybody, next we're going to hear from someone who's been on the front lines fighting for health care with her organization for a long time. Somebody who knows a lot about politically motivated attacks living here in Washington, D.C., because we know that this isn't really about healthcare. It is actually about taking away our healthcare, but this is about creating a narrative of mismanagement and chaos that when it doesn't actually exist, so that they can send in troops, disrupt people's lives, kidnap our neighbors, and cause general harm to everybody. So now we're going to hear from Raina from Spaces in Action.
Hola, buenos días. Soy Reina, una madre orgullosa, inmigrante y residente de Washington, D.C. Soy una sobreviviente de violencia y de trata de personas. También soy líder de la organización Espacios en Acción y activista local.
Hello, my name is Reina, and I'm a proud immigrant mother and resident of Washington, D.C., a survivor of violence and human trafficking, and I am also a leader with the organization Spaces in Action and a local activist.
Llevo más de 7 años en este país al que llamamos hogar. 2 de mis 3 hijos nacieron aquí, aunque tengo varias afectaciones de salud grave, como problemas cardíacos y presión arterial alta. Soy el pilar de mi familia y hoy estoy aquí para alzar y usar mi voz por mis hijos y su lucha por el acceso y la permanencia en Medicaid y por medio del programa de seguro médico para la niñez, CHIP por sus siglas en inglés.
I have lived in this country we call home for over 7 years, and 2 of my children were born here. Although I have serious health conditions, including heart problems and high blood pressure, I am the pillar of my family, and today I'm here to use my voice for my children and their fight to access to and continued coverage under Medicaid through CHIP.
Tengo un hijo de 4 años, ciudadano estadounidense, diagnosticado con autismo. Él depende del programa CHIP de Medicaid para sobrevivir, tener calidad de vida y poder acceder al cuidado de salud que necesita y merece. El autismo es una condición que dura toda la vida. Y las necesidades, las fortalezas y los desafíos de una persona autista pueden cambiar con el tiempo. Y es por eso que la importancia del Medicaid en nuestras vidas tiene que cambiar, porque para lograr una detención e intervención temprana, además de terapias con expertos que marcan una gran diferencia en las capacidades y los resultados del futuro de nuestros niños.
I have a 4-year-old son, U.S. citizen, diagnosed with autism. He depends on Medicaid CHIP program to survive, have a good quality of life, and access the health care he needs and deserves. Autism is a lifelong condition, and the needs, strengths, and challenges of a person with autism can change over time. That's why my Medicaid is so important in our lives, and enabling early detection and intervention, as well as therapies with experts that make a huge difference in our children's abilities and future outcomes.
La historia de mi hijo no es una historia aislada. Actualmente, Medicaid brinda cobertura médica a más de 30 millones de niños inscritos en el programa de seguro médico infantil CHIP, muchos de ellos con autismo y otras condiciones crónicas que requieren atención constante y acompañamiento a la familia.
My son's story is not an isolated one. Currently, Medicaid provides health coverage to more than 3 million children enrolled in the Children's Health Insurance Program, many of whom have autism and other chronic conditions that require constant care and support for their families.
Es por eso que estos recortes que pretenden hacer los republicanos al Medicaid son una estrategia partidista para debilitar el programa y retener los fondos federales a los estados que han ampliado el acceso a Medicaid. Ustedes no nos engañan, no nos van a engañar, porque esta narrativa de mentiras que están usando son un ataque directo a nuestra propia existencia de nuestras familias y la de nuestros niños. Pero ¿saben qué? No nos quedaremos callados.
These cuts the Republicans are proposing to Medicaid are partisan strategy to weaken the program and withhold federal funds from states that have expanded access to Medicaid. You are not fooling us. This narrative of lies is a direct attack on our very existence and that of our children, but we will not remain silent.
Gracias. Sus mentiras convertirán la prevención y el manejo de condiciones crónicas como diabetes, hipertensión, asma, en emergencias mortales, quienes necesitan medicamentos esenciales como la insulina, medicinas para la presión, eso enfrentaría una muerte prematura.
Your lies will turn the prevention and management of chronic conditions like diabetes, hypertension, and asthma into deadly emergencies. Those who need essential medications would face premature death.
Esta crisis de acceso a la salud es el legado y los republicanos y del gobierno actual y va más allá del sufrimiento físico. La falta de cobertura llevará a miles de familias a la bancarrota. Las deudas médicas son una de las principales causas de la ruina financiera personal de los Estados Unidos. Y para nosotros, la clase trabajadora, una sola visita a urgencia o el pago mensual de una medicina o las terapias de mi hijo con autismo pueden acabar con nuestros pocos ahorros y poner el peligro a nuestra economía.
This healthcare access crisis is the legacy of the Republicans and the current administration, and it goes far beyond physical suffering. The lack of coverage will bankrupt thousands of families. Medical debt is one of the leading causes of personal financial ruin in the United States. And for us working class people, a single visit to the emergency room, a monthly prescription, or my child's autism therapy can wipe out our little savings and jeopardize our financial stability.
Hoy estamos aquí no rogando ni pidiendo, estamos exigiendo una acción decisiva y audaz rápida del Congreso. Necesitamos que fortalezcan el programa de Medicaid. Sabemos que el programa cuenta con mecanismos sólidos y que garantiza su integridad. Contrariamente, las propuestas mezquinas republicanas para recortar el gasto de Medicaid generan ineficiencias y debilitarán los esfuerzos actuales y futuros para mejorar la integridad y eficacia del programa en lugar de fortalecerlos.
We demand decisive and bold action from Congress to strengthen the Medicaid program. We know the program has robust mechanisms in place to ensure its integrity. Conversely, the Republicans' petty proposals to cut Medicaid spending will create inefficiencies and weaken current and future efforts to improve the program's integrity and effectiveness, rather than strengthen it.
Y le digo al Congreso, no nos quedaremos callados. Vamos a exigir Medicaid para todos. Los recortes al Medicaid matan. Gracias. En un pueblo unido jamás será vencido. Gracias.
And we say to Congress that these Medicaid cuts will kill, and the people united will never be divided.
Thank you so much. Thank you. All right, everybody. I said before to think about what the common denominator is with all of those states. Here's the answer. All of those states except for one are run by governors who are from the Democratic Party. So this is clearly a politically motivated effort to strip funding from states that will not vote for Donald Trump and the MAGA party. So a representative from one of those states who has been fighting for health care for all of us for a really long time now, Asia Betancourt from Vocal, New York. Woo!
Let's be very, very clear. These people whom we voted into office, okay, are not our friends, they are our enemies, okay? Everything that has happened is gaslighting us. Having Medicaid improves the quality of life. Removing it is going to deter the quality of our lives. At what point do people matter? At what point Do you think that it can't happen to you? You're not going to be in those jobs forever. It could be your loved ones, your family members. I have been fighting this fight a long time. And I'm thankful for Medicaid because of Medicaid, I'm alive. But just as quickly as they gave it to me, they're taking it from me. So my life mattered 10 years ago, and now it doesn't matter. Everybody here has a story. Everyone here is struggling. And even in your families, people are struggling. At what point do people's lives matter? These cuts are like human genocide. These cuts are going to kill us. And those people in office who get those giant paychecks off of the taxpayers' money are doing nothing but lining their pockets. The money goes from Medicaid to the rich. Explain that to me. Explain it to me in a way that I can understand it, because I'm not. We're being treated like collateral damage. And it's pissing me off really bad. And I'm seeing too many people struggling every goddamn where. When the hell do we matter? When? I'm gonna die because of these goddamn cuts. I've been HIV positive 40 years. And as of 5 years ago, they started removing the medications I need to help me live. So you give it to me and then you take it from me. Listen, let's stop letting them gaslight us. Let's be in their faces, be consistent, and don't stop fighting, because it's our lives we're fighting for, damn it.
When Medicaid is under attack, what do we do? When Medicaid is under attack. All right, everybody. We all have this organization to thank for giving us the health care that we do have right now. They both fought for the passage of the Americans with Disabilities Act, and then they are really responsible for not letting Trump and the MAGA Republicans in Trump's first term take away the Affordable Care Act from all of us. So I'd like to welcome up Laura from the amazing organization ADAPT.
Thanks, Hello, Laura. No problem. Hi, I'm Lauren. Let's try this again. Hello. When I say our homes, you say not nursing homes. Our homes. Not nursing homes. Our homes. Not nursing homes. Our homes. Not nursing homes. All right, we need this energy all day. I'm here with Pam Auer from National ADAPT. We are here because it is very clear to us that the Trump administration wants to segregate people with disabilities. Okay, we're talking about segregation again. The hearing today is a sham. We know it's just a way to try to say that there is fraud, waste, and abuse in order to cut the programs and services that provide home and community-based services for people with disabilities to live in the community. If these programs are cut, people with families, people with jobs, people in every community will be forced into institutions and nursing facilities. Our homes! Our homes! We understand that there could be fraud, but we're saying attack the providers who do it. You've already caught some clearly, not attack the program. Do not attack the program. Do not attack Medicaid. This is all a cover to take money away from the people who need the money for home and community-based services to give it to the rich. It was just said before, we've said it a million times, stop stealing our services. So I wanted to also have my colleague Pam come up to talk about how she has been transitioning people out of nursing facilities and back into the community, and how we wish we could be here to talk about how the politicians can strengthen home and community-based services. We don't want to be here because the whole service and program is at threat. We need to be here to talk about how we can make it better. And so that's what she fights for every day, making home and community-based services, transportation, accessible, affordable housing. We need all of that to work better for our people to be able to live in the community. So I'm going to let Pam come up and talk a little bit about that. I'll hold it. You want me to hold it? You got it?
I'm going to be real brief. My name is Pam Auer, and I work for Thrive Center for Independent Living in Harrisburg, Pennsylvania. And we do nursing home transition. And we are proud. That's one of our, we're proud of all of our programs, but that's the one that we are most proud because we are able to free institutionalized people. People who are incarcerated in nursing homes, and I say incarcerated because they have no choice of what they eat. They have no choice when they go to bed. Get a shower once a week because that's all they're allowed. You know, they don't go out. They're not able to go out in the community unless they have somebody come with them and sign them out. They are incarcerated. And we help them with programs funded through Medicaid to be able to support them in order to find housing, be able to get them the household items that they lost when they were incarcerated in the nursing home, to be able to have a full apartment, have a rich life, move back into the community, and we work to make sure that we overcome any barriers that cause them to go into the nursing home so they never have to go back again. But the key part of nursing home transition that we cannot live without is the Medicaid. The Medicaid is what supports the individuals to have nursing home transition. It's what supports them to stay in the community with direct care workers. We need our direct care workers. We need our Medicaid to pay for that. We need the supports to stay in the community. Our people deserve to live and thrive in the community. They have the, sorry, hold on, Puntak, and I want to show you. This is how proud we are of what we do. We expect people to thrive in the community. So please help us make sure that our community, our consumers, our people with disabilities do not lose access to Medicaid. Don't cut what we need. We've been through so many times. I don't know how many times we've heard fraud, waste, and abuse, and we say those are lies. They've never been able to show us. In our state, we fought back a governor because he was trying to cut our Medicaid and cut our programs, and that was a while ago. And it feels like everything old is new again. So we need to make sure our federal government knows that they don't use the excuse of fraud, waste, and abuse to kill people by taking their Medicaid. Thank you.
And just one more thing for National Adapt, we have a new campaign. It's called Disabled, Not Disposable. And we're asking folks to make quick videos on their cell phones or have someone shoot it for you and talk about why Medicaid is important to you and say disabled, not disposable in the video. Thank you.
Disabled, not disposable. Remember, everybody, let's do some videos after this. If you've got time, we can film each other. Thank you. Thank you, Adapt. All right, we are going to wrap it up, and we're going to head over into this hearing, and we're going to let them know that that if these cuts go through, if they strip funding from these 10 states and then strip funding from other states for made-up lies, that they are going to create real harm and maybe even kill some of the people that are in the room. Our lives are on the line. Medicaid is our health care. It creates the infrastructure that gives us our hospitals, our social service organizations. So we are not going to let them do this. So everybody, thank you so much for coming out. Health care is a right. Health care is a right. Say what? Health care is a right. Health care is a right.